Joining us now is Dr. Elizabeth Vliet, and she's been advocating for the President Trump, to issue an executive order for the president to get governors off their backs, doctors get governors off doctors' backs. These governors are banning hydroxychloroquine. It makes no sense. We just banned it in Virginia. If your doctor prescribes something, why is a governor involved in this to try to make heads or tails out of it? Is Dr. Elizabeth Vliet. Thank you, doctor, for being with us today.
Well, thank you, John. You're in my home turf area. I was born and raised in Virginia. I am absolutely appalled to see what has happened to my state, the home place of liberty and the American Revolution. And Liberty University I'm glad they're standing up. These governors that are interfering with freedom, medical freedom, patients' lives, and doctors helping patients by saving lives is just absolutely unprecedented in my entire life. And it is actually, the governors are illegally overriding the FDA regulations that allow any doctor in the United States to prescribe any FDA-approved medicine off-label in the best interest of the patients based on the doctor's evaluation of the patient and the doctor and the patient deciding together. And basically what we're saying is the doctors' groups. I was one of the board of directors for the organization that is suing the FDA to get the emergency use authorization approved for outpatient early use with hydroxychloroquine that they restricted inappropriately. And what your listeners don't understand, perhaps, is that the FDA restricted hydroxychloroquine for outpatient use at the beginning of the COVID illness when it is the most effective, which they've known from the NIH and CDC studies for the last 18 years. Mm-hmm. So this is not new information. And one of the things that's so appalling is the FDA put it on its website that they are warning against outpatient use because of the risk of harm, and yet all of their data is based upon critically ill inpatients, an entirely different population. And here's the thing that really doesn't make sense, and most of your listeners don't have to have a medical degree to understand this. Why is it safe for hydroxychloroquine to be taken by outpatients with lupus, rheumatoid arthritis, and malaria, and perfectly fine for them, but suddenly not fine for someone outpatient who has the early symptoms of COVID? The same drug is being restricted for one disease and then totally okay for several other diseases with people who may have more health problems than those who actually have the early symptoms of COVID. So none of it's making any sense. It's all political, and it's driven by a desire to government politicians, FDA bureaucrats, interfering with the practice of medicine, and that is our key point. The other point is every country that is using hydroxychloroquine, and I've been digging into this since early February when we first learned of the coronavirus, and I've been on conference calls with doctors from other countries, doctors all over the United States. The frontline doctors treating patients are seeing that hydroxychloroquine, zinc, and azithromycin work well to stop the viral progression if you give it in the first 3 or 4 days of symptoms. By day 6 or 7, the viral load explodes, people get exceptionally sick, and then this virus triggers the exaggerated immune response, and it's the exaggerated immune response, inflammation, blood clotting, and all of the damage from the cytokine storm that is causing people to be so critically ill and have the lung damage, heart damage, and kidney damage that ends up causing death. If you talk to the critical care doctors, they're seeing a different disease by the time people get to the hospital and the ICU. And in the outpatient setting, most of your listeners know you treat a virus early, people have been told for years, take Tamiflu within the first 48 hours of the flu symptoms. All viral diseases, shingles, herpes, the flu virus, colds, everything works better if you treat it early. The same is true with COVID-19. And by the governor stepping in and blocking hydroxychloroquine and telling doctors that we can't prescribe an FDA-approved drug that has one of the best safety records for 65 years of most of the drugs we use, is just outrageous, and it's costing additional lives in the United States. As of August the 2nd, we had lost 27,896 more American lives waiting for Dr. Hahn, the FDA, to approve the emergency outpatient use authorization that two major medical institutions in the United States requested on July 1. Henry Ford Health System found that if they gave hydroxychloroquine with zinc and azithromycin in the early first 24 hours of hospitalized patients, it cut the death rate 51%. That's huge. And then in the outpatient studies, Dr. Zelenko in the United States, others in the U.S., as well as France, Italy, India, South Korea, Brazil, all of these other countries that are, Israel's another one, Turkey, another. All of these countries are using it very early. And Dr. Zelenko's data in over 2,500 patients showed that he had a better than 85% reduction in deaths, and less than 1% of his patients went in the hospital. This is absolutely unconscionable that they are hiding that information from the American public and that the FDA is sitting on it when they know that their data of harm came in very critically ill inpatients where a lot of the heart damage was coming from the cytokine storm, which the doctors know, and Dr. Hahn should know. It's truly, this is just devastating that we've had so many needless deaths when there's a treatment available that helps.
Let me just ask you this, Dr. Vliet, Elizabeth Vliet with us, and I appreciate what you've just outlined. But it's kind of mind-boggling here that you have a drug that is approved by the FDA that has been prescribed for other things like lupus, as you mentioned, for many, many years. It's readily accessible, and it's very cheap, right? It's one of the cheapest drugs available. So I don't want to put that money plays a role here. But why on earth are governors getting involved between you and your doctor? I mean, if your doctor is, if I had COVID-19 and I decided, my doctor said, hey, we need to get you on hydroxychloroquine immediately, and he goes to prescribe it, and it's outlawed by the governor for COVID-19. But if I had lupus, he could prescribe it. How the hell does that make any sense?
It doesn't, and this is what is so outrageous. The governor does not have the authority to override federal regulations. Once the FDA has, and this is coming from the legal counsel for our organization who's filed suit. Now, he's not filed suit against the governor of Virginia, but there are suits that have been filed by doctors groups in Nevada and Michigan, and I believe one is underway in Texas as well. This started with Governor Cuomo issuing the most restrictive order in the country, and that's partly why New York had so many nursing home deaths. The doctors, not only did Cuomo mandate that infected patients had to go back to the nursing homes, but he also restricted hydroxychloroquine, the most restrictive of all. He issued that order saying that doctors could only use hydroxychloroquine for hospitalized patients on a clinical trial. Well, look, the doctors in New York were swamped. Doctors and nurses were just exhausted with the load of patients they were getting. They had no time to ramp up a clinical trial and go through IRB approval and study design and all of this. That's absolute insanity, and it's not required. It's not an FDA standard that we have to have a randomized clinical trial before we can approve a drug. That's not how they normally approve other medications. There are many different types of clinical evidence, case control studies, which we have more than 12 just published recently. We're looking at large series of case-controlled studies where hydroxychloroquine, zinc, and azithromycin were given early in the treatment and showing dramatic reductions in death, reductions in hospitalizations, and that's coming in from countries around the world. Fauci likes to dismiss all of that and call it anecdotal, which is just totally wrong. Anecdote means that you have 2 or 3 patients who responded a certain way, and you're sharing that, and then you use that observation to design a study to see if it works in more people. Well, we're way beyond that. We have thousands and thousands of patients from all of these different countries. In fact, there was a dramatic example in one area of India where they gave it to 150,000 people and cut the death rate drastically. And in 3 different countries, Ecuador, for example, where the virus was really out of control, and in the Para region of Brazil, because I was on the phone with doctors in Sao Paulo, and one of the things that was really striking was when they unrestricted hydroxychloroquine, and we sent something like 75 million doses of hydroxychloroquine. Our government, taxpayer money, sent 75 million doses to Brazil to help them out, and yet our governors are restricting American citizens from getting it. Now, if you don't think that sent me through the roof, but
so
Brazil,
I mean, look, what you're outlining, Dr. Elizabeth Vliet with us. What you're outlining here is that I'm trying to figure out why, if you're the governor of Virginia, and it's proven that this drug is helpful to some people, and it's got nothing to do with the governor. It's between you and your doctor decides to prescribe this. What ground? Not it's okay. Forget what grounds, what authority. Why? What is the motivation? I'm a governor. Why would I say to a doctor, you can't prescribe this particular drug? Is it because Trump said it was a good drug, or is it because? And I don't want to get nefarious, but doctor, got to ask the question. Is it because they don't want people to recover, because they need COVID-19 to go forward, and they need people to die so they can get a mail-in ballot? I mean, I don't want to say that on the air, but you got to ask the question. Why is a governor telling my doctor what drug I can have if it's approved by the FDA?
That's exactly right, John. You absolutely nailed it. And part of it is all about control. It began with the 3 leading Democrat governors that started this restrictive movement on hydroxychloroquine: Cuomo in New York, Whitmer in Michigan, and the Nevada governor. And you see what else they've done to control and micromanage people's lives and keep the states locked down and cause economic damage to the school children and their ability to get their education. Working parents are affected. I mean, I've got family and friends and patients all in Michigan, and Michigan has been treated like the governor is a dictator. It's just appalling. They couldn't even buy seeds and fertilizer and work on home projects because the governor banned them buying seeds and fertilizer and paint, for heaven's sakes. What does that have to do with COVID-19? What has happened is absolute, out-of-control governors becoming tyrants over their citizens. It's not based in science, and they keep claiming that any of us who speak out against the narrative that we are anti-science. That's totally wrong. I'm reading the scientific studies, and I guarantee you they probably are not. I've been studying this literature and the studies and the background on the use of hydroxychloroquine since February, when we first learned about coronavirus, right after the president banned the flights from China. For the governor to step in and restrict doctors from prescribing, I mean, illegally restricting doctors, okay? If for the governor to do that, there can be no other motivation other than control, which is outrageous in the country that was founded on liberty and the freedom.
This doesn't have anything to do with that. No, Doctor, this has nothing to do with liberty, freedom, and government. Has everything to do with a mail-in ballot. This whole thing has to do with beating Trump. I guarantee you, if Hillary Clinton had won the election, and it was 2020, and Hillary was running for re-election, and everything was the same, there's not a single governor, and she has said the same thing about it. There's not a single governor that would have banned this drug and gotten in between patient and doctor. Not a single one. They're doing it for one reason. Anything that they can, if the drug is successful and less people get sick, and they feel, okay, there's a therapeutic here, and the fear goes away of COVID, because that's what this whole thing is based on now. Fear. That's it. It's all fear. People are scared. And so if that tanks, the economy goes back, Trump wins, and then they jump out of windows or something. So this is all, it's had nothing to do with liberty and Thomas Jefferson. This is all about Trump, because the same governors would have done the exact opposite had Hillary been president. And nobody can deny that. So the fact that a governor would tell my doctor, you can't prescribe this drug for this disease or affliction, but you can subscribe it for something else. I mean, I guess my doctor would say I'm prescribing it for lupus, even though I don't have lupus, if he thought they could help me. That's insane, too.
Well, I think you're right, and that is what makes no sense, and the American public is getting tired of it, and that's why President Trump really needs to step in with these executive orders. I sent the first letter with 1,300 doctors and healthcare professionals April 10th, and we signed this letter, and we were asking the president to issue the executive order to do two things.
Yeah, he needs to do that. Yeah, he needs to do that.
And make the
he needs an executive
order for emergency outpatient approval so that doctors can make the decision. I am not saying it works for everybody. I'm saying everybody deserves a chance with their doctor to make that decision without the governors and without the FDA restriction incorrectly based on the wrong data. And they know it's based on the wrong data. And the other executive order is to stop the governors from intervening in the doctor-patient relationship and overriding existing federal regulations that allow us to make the decision off-label. Not a single patient that I have treated with hydroxychloroquine, azithromycin, and zinc, plus the vitamin C and vitamin D, none of them have had to go into the hospital. None of them have died, and most of them haven't even really had any side effects at all. They've hardly known they were taking anything. It's an extremely successful drug, and I've had two diabetic patients, almost 70 years old, quite sick on the 3rd of July. I knew that they could be deathly ill in the hospital if we waited another 5 days to get through the holiday weekend. Their primary care doc had not called them back. On the morning of July 3rd, they called me and they said, Dr. Vliet, we're really frightened. We can't get a call back. We can't get a COVID test. We've both got symptoms. We're taking care of our elderly aunt. Can you please help us? So I did the medical consult for them, went through all their risk factors, and then I called the pharmacist, and I said, look, the pharmacist was in Texas, and I said, we have got to get these patients treated. Will you dispense the drug? They've got all the symptoms. They both have diabetes. They're both very high risk, and they may be in the hospital and dying by next week when somebody finally gets around to calling them back. They needed a diagnosis, which is unusual. That's another one of the restrictions that went into. I said, fine. They have a viral illness, unspecified. Will you dispense it on that basis? The pharmacist said, that works. I'll do that. We got them the hydroxychloroquine, and by Monday, they were both better. Fever gone. The cough was better. They were breathing better.
I have to go, but let me ask you one question from Amy in Fairfax, Virginia. She says, ask Dr. Vliet, why can't hydroxychloroquine be covered by right to try? And I only have a minute.
Well, it could be. It could be, except the difference is people in the early outpatient stage are not terminally ill, and the drug is already FDA approved. But it could be expanded to cover it, absolutely. Well, it's covered under existing FDA regulations for off-label use if we get the governors off our back.
Well, I hope the president takes your advice and does this executive order. It's mind-boggling to me that a governor is going to be able to tell my doctor that he can't prescribe something for me, which is FDA approved to treat COVID-19. But if I was diagnosed for lupus, which is bad enough, I can get it prescribed for that. So if I wanted it and the doctor said, hey, you really need to have this for COVID-19, he would have to, I don't know, you can't lie on the thing, but it would be like, it just doesn't make any sense that you could prescribe it for one thing but not another. And it's all politics. It's sick. What has happened here?
You have a platform. Keep the pressure on. We need
sick.
Pressure. We need the president to act on these executive orders.
They would rather people stay sick in fear, or like you said, 51% of people recovered, didn't die. So they would rather have people die so that they can go on CNN and say so many people died so that we can get a mail-in ballot. These are sick people. They're sick, all of them. They're sick. These governors are whacked. Unbelievable. So, I mean, to politicize a drug because it might be helpful, because the president said it might be helpful, and now you're going to politicize that and not let people recover and get in between you and your doctor? I mean, and these are governors that you're electing. These are sick people.